Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. I am Dr. Shahzad Wasim from Pakistan, and on the request of my some students, I am making small videos on different topics which many of you may be knowing before. But there are some misconceptions which are present, and I am trying to clear those misconceptions. And these small videos are regarding the may not be all, but some of them definitely also relate to the questions which are being asked in the examination. For example, today I will talk about very simple diseases of eyelid, that is Stye and the Chalazion. These are the most common and most simple, and every teacher expects that every fourth year student or undergraduate student must know each and everything about at least these two lesions. So, what is Stye? Stye is simply an infection of the follicular gland. That's it. Uh, there are many different types of glands with difficult names, which you not need to remember all, but if you want, you can read in the book. But you can simply say it is the infection of the glands at the lid margin. At the lid margin. Okay. And what is Chalazion? Chalazion is the Stye, if you add it a bit better definition, an acute infection of the follicular glands at the lid margin is called Stye. And when we define Chalazion, it is a chronic granulomatous inflammation of the meibomian glands away from the lid margin. So these definitions tell you the differentiation between the two lesions. Stye is acute and Chalazion is chronic. And Chalazion is the inflammation of the meibomian gland, not necessarily the infection. It is mostly chronic granulomatous inflammation of the meibomian glands which are present in the palpebral conjunctiva. And Stye was of the infection of the follicles which are present at the lid margin. So Stye is at and Chalazion is away. Treatment of Stye is removing the affected eyelash by simply applicating it with the forceps, number one, on the slit lamp. Number two, you will give systemic antibiotics, topical eye drops, antibiotics, and if patient is feeling pain, you can give some painkiller. That's it. Uh, as far as the treatment of Chalazion is concerned, it is a painless lesion, and as it is usually not infectious, there is no medical treatment, and you will have to perform a small surgery which is called incision and curettage, in which with a special clamp which we call Chalazion clamp, we hold the Chalazion, invert the eyelid and give a vertical incision over the Chalazion from the conjunctival side, not from the skin side, so that the scar does not form. And vertical incision is given because the placement of meibomian glands anatomically is vertical. If you give horizontal incision, it will fracture the tarsal plate. So vertical incision is given, and from that Chalazion, the granulomatous tissue or some pus will come out, and you will simply instill some antibiotic plus steroid ointment, and you will close the eye for 1 or 2 hours, and after that you will give a combination of steroids and antibiotics, and ask the patient to visit you after 1 week. So this was a small video. I hope the confusion between the Stye and the Chalazion is now to an extent relieved. And if you have any questions, please post below this video, and hope to see you people again, inshallah. Thank you.